Hi, my name is Dana Radhan. I'm originally a student from Kuwait. I'm an international student here at Dalhousie University. I'm currently in my third year of studies at Dalhousie Dentistry, and it's been 8 years since I first arrived to Canada. I'm not a native Haligonian, but I consider Halifax a second home to me. It's where I've come to establish many lifelong friendships and great memories. I've always been inspired by the generosity and welcoming nature of Canadians and the diversity that exists here. I've always really felt welcome here. However, since starting the film for MOSH, I've been introduced to something that I never knew for the past 8 years, which is the large population of homeless people and street-involved people that exist in Halifax that unfortunately often go unnoticed and are often marginalized. Since starting making this film, I've had many conversations with people who are street involved or homeless, and a common theme that I found was they often felt judged for their lack and inability to attain a job or have access to healthcare. But unfortunately, it's a vicious cycle where because they are homeless, they are unable to attain a job and thus are unable to have proper access to a family doctor or healthcare.
See you later on. I'm a human being too. I have feelings. You know, I feel pain the same way everybody else feels pain. Just because I'm out here doing what I'm doing, people think that I'm lazy. I'm not lazy. People don't understand how debilitating mental health illness is.
This is where MOSH comes along. MOSH was established in 2008, and it provides effective access and equitable primary health care for community members who are homeless or street involved.
My name is Patty Melanson, and I'm the team lead of the Mobile Outreach Street Health Program, MOSH for short. It was myself and a woman by the name of Diane Bailey, who's the director at Mainline Needle Exchange, and we talked about the fact that really there wasn't a whole lot of service for people who were homeless, who were street involved, who were suffering with pretty serious addictions and untreated mental illness. We've created a healthcare service that delivers healthcare exactly where people are, literally and figuratively. You know, we go to where they are. We also appreciate where they might be in their lives and what they might want done and what they might not want done.
I'm Rick Swain. I am the registered nurse that works as part of the MOSH team. So we have some basic supplies, mostly dressing supplies that we're going to keep around pretty steadily, wound care, some basic hygiene stuff that we can help with.
Patty and I established a relationship very quickly through one of her clients. It's a funny story, actually. He was a French fella from Quebec, had a really bad toothache and had negative experiences in the healthcare profession as well as in dentistry throughout his life, and was really quite fearful of coming to the dentist. How his fear manifested itself was kind of outward, so he was pretty verbal and a little bit bravado. I'm trying to make this politically correct. Patty brought him here, and it took her about an hour and a half to actually convince him to come down here. His pain was really significant, to the point where we couldn't manage him here. We had to send him over to the VG hospital so he could be sedated. The things you don't think about when you're treating a person who is either street affected or homeless is they don't necessarily have a place to stay to recover afterwards, a safe place. in collaboration with the North End Community Health Centre, the Faculty of Dentistry has established a dental clinic down in the North End Community Health Centre on Gottingen Street. And we've been running that clinic with our dental students and our dental residents and our dental hygiene students for the last 4 years down there very successfully. I always jokingly say down there we don't get paid in money, we get paid in hugs. So it's amazing the care that we provide, and it's amazing the people that we meet down there. And I have never had a student that goes down there that doesn't want to come back again.
It's small things frequently that seems to be making the difference as opposed to one large thing.
Thank you, dear.
You are very welcome,
Yeah,
Donna.
good. So take care, George. I'll say a prayer for you for tomorrow.
I would summarize us as making a lot of bridges for people. Be that knowledge, be that physical needs, be that medical needs, be that following up on someone's history. We can help make those bridges that makes it easier for someone to walk over those bridges.
Well, I think we've learned a lot about privilege over the last few years in this work. I think it's you start out, like, my understanding and appreciation of privilege is so much deeper than it was when I started. When I started, I thought privilege was having a job, having a house to live in, and having money. And those are privileges, you know, that is a privilege. But what I've learned too is that it's a privilege sometimes to be loved. We work with people who nobody in the run of the day acknowledges maybe who they are, acknowledges their existence in a way that is meaningful, that is that has them feeling cared about. And so that's privilege, to be cared about. It's privilege to know that if something goes wrong, there are people who will help you. If there's something that goes right, there are people who will celebrate with you. But we often work with people who that they can't get that experience on either end of the spectrum.
This year, Dalhousie Dentistry, along with different health faculties, are coming together for the annual event of For the Health of It. For the Health of It is put together with the goal of raising funds for a charity that's making a difference in the lives of people within the community, and this year MOSH was chosen. I think it's not only important that we support organizations such as MOSH, I think it's crucial for the well-being of the community, and I think the work that they're doing is amazing. So I'm asking everyone who's watching this to please help us support MOSH and the great work that they do. Thank you so much.